The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Hello, everyone. Welcome to another episode of the Dental Brief. So glad to have a returning guest on the program today. Many people know who he is. Dr. Robert Maguire. Go ahead and say hello to everyone.
Hello, everyone. Dr. Rob Maguire here. Great to be with you.
Yeah, it's great to have you. Like I said, I know you're known as the fulfillment coach. Your website's the fulfillment is thefulfillment.coach. Just so thefulfillment.coach. Been in dentistry for how many years? How long have you been in this industry?
I practiced dentistry for 34 years before retiring in 2018. So I'm still at it. I might not be contributing clinically, but I'm out there sharing my gray hair and bald head as far as the communication piece.
Yeah, so fantastic. I'll let people tune into the prior episode. We can find out how you got involved in dentistry, but I want to give us more time to kind of get in the meat of the episode. First, let me ask this question to learn a little bit more about you. Why do you go by the fulfillment coach? Why fulfillment? That is, to me, that means a lot. For other people, I'm not sure what that necessarily means to them. What does it mean to you?
Yeah. Well, let me backtrack, Patrick. In the first few years of my practice, I was making money, but I wasn't fulfilled. Mm-hmm. And fulfillment to me is doing the dentistry you love with the patients you love and with the team that you love. And so once I got that in my head and figured out how I wanted to practice and who I wanted to practice with and what was the type of dentistry that I wanted to do, my bucket became filled instead of being on the hamster wheel and kind of doing single tooth dentistry. It was a rat race. And so through the help of places like the Pankey Institute and the Dawson Academy, I was able to fine-tune my practice into one that was joyful, fulfilling, and financially rewarding. So that's my mission right now, is to help other dentists get more joy, get more juice out of their practices. And for me, the missing link was the communication piece. Because at the beginning, I couldn't talk to a toad. I was all in my head, and I would give these long, drawn-out discussions or treatment plans that pretty much blew a large percentage of my patients away.
Sure.
Well, once I learned how to connect, things got better. So that's my mission and my passion right now, Patrick, is to help other dentists get juice out of their practices and their lives.
Yeah. That reminds me of something I'll put out there real quickly. Years ago, I saw written in the sales organizations up on their wall, huge letters. I mean, this thing was 50 foot across. It said, sales are never lost over a couple of dollars. They're always lost over a couple of words. Right. So it's kind of interesting that you talked about that, and I'll throw that out there. Maybe we'll come back to it or maybe not. Let's talk about this. So fulfillment, full, right? Pouring over, right? That's what full is. Wobbles a little bit, it pours over, right? When you got a glass that's full. And then you've got miserable, right? So that's down at the bottom. What's in between that? So how do we go from, what can we talk about today that'll take someone from being just miserable in their profession, in their practices, in their jobs, to, hey, okay, this isn't so bad. How do we get them to that? What's going on today that if we could give them some information, we'll get them to that not too bad or not so bad career?
Yeah. Patrick, this answer is going to sound simple, and it really is. It's figuring out who you are, what you're about, and why you're doing what you're doing. Well, how do you get to that point? And what you have to do is you got to slow down and stop for a minute and think about, what is it that you want? What is it that gives you juice? What is it right now in your practice that when it happens, you go, oh, that was a great day. Like when you may have cemented those beautiful crowns on Captain America and they went in with no adjustments and he was overjoyed. Or when every patient showed up on time and things just went smoothly and you were on time. So it's really asking yourself the question, and it's an overused question, but if you had a magic wand, what would you want your practice to look like? So start with a picture, because I think what creates stress is a lack of clarity.
Mm. Yeah,
That you're
cognitive overload. Yeah,
or you're looking for love in all the wrong places. And honestly, in my early days, Patrick, I was all about the buck. I was totally focused on the buck and production and collection and all of this stuff. Well, not only did I drive myself crazy, but I drove my team crazy. Well, what was interesting is that when I got my focus off, totally focused off the dollar, and started focusing on caring for people, guess what? The money came. It was like, take care of those geese that lay the golden eggs, and the golden eggs will come. Now, that doesn't mean ditch looking at numbers. Yeah, you need to look at your numbers, but you don't need to obsess over them.
Sure. Yeah, I think a big part of that money, part of this tying money together with success and happiness, is because people like to buy a lot of things in this country, right? And the more things that you have, the more things that you have to pay for, the more production that you actually have to do. And I think desperation is something that people can smell from a mile away. I think patients can smell desperation. If you're trying to pay your bills and pay for the new Porsche or pay for the second home and pay for this and pay for that, you're desperate for that production and those sales. And it actually makes it counterproductive. It actually makes it harder, in my opinion, to actually get that case acceptance to happen. I want to talk about trends. We're kind of doing this a little backwards today, and I like it. Let's talk about trends a little bit. What is a problem that you see that is trending that most dentists face? And usually when most dentists face them, by the way, most business owners face them. But what are some trends that you're seeing right now that are causing a lot of problems, stress, heartache, and challenges for dentists?
Yeah, I mean, obviously inflation has been a stress on dental practices. In fact, the last ADA, I think it was April 2023 report, showed that a majority of the dentists last year had a 5% increase in their overhead.
Yeah.
So that is, if you talk about a trend, well, that appears to be a trend. Workforce shortage, I think working through that is something that dental practices need to be more concerned about. So when you ask me about trends, I would hope that the trend would be for dentists to realize that it takes more than just doing great dentistry to be successful and happy in your practices, that you got to be a leader as well. Now, that doesn't mean you have to do every little step in the process, but you have to be that guiding light that equips your people and engages your people to then produce or to be part of a team, because that's where the production comes in, Patrick, is that when you have a team that is engaged and enjoys what they do, they will then be able to serve your patients with all their heart without this distraction of, I owe, it's off to work, I go.
Sure.
So if a dentist is in the trap where they've got a lot of debt, well, start tackling it, because debt it's an energy vampire, if I could use that phrase. I don't know if that answered your question. I think that there's still room for private practices in the United States today. So the trends, DSOs are scooping up dental practices, and just like private practice, some are good, some not so good. So
Sure. Yeah, that makes total sense to me. When we talk about trends a little bit, I like to bring that up, not to make things worse, but to actually make them better. I think a lot of times when there's a trend, when there's a hiring issue, people start. You may have no hiring issue, or you may be fully staffed and fully equipped. But the more you think about it, and the more you almost obsess about it, and the more you hear about it, the more problem it will become for you at some point. You'll start to drink the Kool-Aid, if you will, and start to think that all of a sudden now this industry, this problem is your problem. Some of these problems that dentists have and business owners have, it's not just dentists, are manifested problems, aren't they? They don't really exist, do they?
you know, it's what you're talking about has to do with where's your focus? Are you focusing on the outside and all the stuff that's bombarding your brain? Or are you focusing on your own journey? Stephen Covey, I love his circle of influence that he talks about. You have your circle of control, your circle of influence, and then you have that outside circle that you have no control over. Well, so often we can dance in that outside circle like, oh, is it going to rain again today? Or did the Red Sox win? Well, you have no control over that. Work on yourself, work on your journey, and keep it at that point. Here's another thing. So focusing on your own journey. I used to think early on that if I didn't have every trinket under the sun, every gadget, every piece of equipment under the sun, I was a less than dentist.
Mm-hmm.
Patrick, people don't care about that. They want to know that you care for them. And so to keep focused on you and your journey and how can you be the best at what you're doing. To me, that's where the focus needs to be. And that's where happiness is.
Yeah, Dr. Maguire, I'm going to ask about working with a coach, a mentor, if you will, mastermind. I know you mentioned Pankey Institute, and I'm not speaking about them specifically, but it seems like that a lot of these mastermind groups, the lunch and learns, the study clubs, are all decreasing in the amount of people attending. ADA membership, I believe, is down. Please don't take that for anything. I just what I've heard, I don't know that it's true. That a lot of the state dental associations, I've heard that they're down as well. People seem to be getting more and more isolated. Maybe tech has something to do with that. Maybe not seeing a value in what some of these institutes charge to be a member. I personally, and I've been sharing this often lately, I've been in marketing for 27 years. It's a long time. It's a really long time. I've been specifically in dental and digital marketing for 17 years. So quite a long time there as well. I'm in a mastermind group that I pay. We have 150, 200 of amazing agencies in different niches across the globe. We meet 3 times per year in person, which is expensive. We pay a monthly due, but we all share information with each other. We all help coach each other. We all mentor each other. The value is unbelievable. The amount of time and money that I save for writing a significant check every single month, and then travel expenses worth it. I'm sure that you agree with that, 100%. But what do you say to that person that's just not seeing value necessarily in being part of a mastermind or a study club or what have you? What do you say to that person?
I say to them, get on board, because we all have limits to our knowledge. And there are so many people out there that are willing to share their experience and their knowledge with you.
Yeah.
And it's not about being a competitor, it's about being a colleague. And early on, and well, here's the thing. So you talk about people isolating themselves and not going to meetings anymore or going less to meetings. Patrick, let's be honest. Where we learn the most, we're in those sidebar conversations.
Right. Yeah,
Maybe not the information that the presenter was giving, but in the little pearls that we gained from our colleagues as we were chatting during the breaks or during lunch. So, and we're wired for relationship. And Zoom is one thing, but being in person with another individual, there's nothing like it.
Right.
So
It's different.
all I can say is just do it. Just if your local component dental society is having a meeting, just go and
Right.
experience it for yourself to
Yeah.
see how good you'll come away being with your colleagues.
Yeah. The thing is that we've all heard this, and it's true. We learn best through mistakes, um, but they're really painful. Learning through other people's mistakes is just as good as a way to learn. Is not nearly as painful, at least not nearly as painful for us. Dr. Maguire, last question for you. I know that you do work with dentists, and we'll work with dentists all over the country, but tell me, if somebody is looking to hire a coach, is looking for someone to help them navigate their journey, their pathway to success, and reach that, what's the best way to vet a coach to work with? What are some things that you would ask, or some things that you would do before deciding to let someone help you get to where you want to go?
I think you want a coach, Patrick, that you can connect with. And when I think of a coach, I think of someone who is more of a listener and more of a facilitator, and not someone who's going to tell you how you should be doing things.
Hmm.
And early on, I got into canned programs that didn't work. But once I got connected with a coach myself who helped draw out of me what it is that I really wanted. To me, that was important. The other thing I would tell to individuals who are looking for a coach, talk to your friends. Do your research. Go to websites and see. I have a services information page on my website that will show exactly how I think and how I process things. We'll look at it and say, is that in line with what I'm thinking? It's got to be a fit, because it's a relationship.
Yeah.
And that's the best advice I can give you. Go to the person that you think you can connect with.
Right.
And so often we'll hire people based on their technical skills, and then we hire them and they're not a fit. So think about fit, as well as what are some of the outcomes that you think a coach can produce for you.
Yep. Makes sense to me. Dr. Maguire, I'm going to encourage the audience one more time, check out the website, thefulfillment.coach, thefulfillment.coach. Then on your website, you've got free 30-minute phone consult right at the top right. I want to encourage our audience to click on that button and schedule a time to meet with you. I know that you mentioned the things that you've done that haven't worked. I'm sure there's tons of them. I've done way more things that haven't worked than things that have worked. So you can find out some of those things that have worked and also avoid the ones that haven't. Dr. Maguire, thanks so much for being here today. We appreciate your time.
I appreciate you, Patrick, and thanks what you're doing for dentistry. It is awesome.
Awesome. Thanks so much for saying so, Dr. Maguire. We'll see you soon.
See you soon.